Well, good morning. Good morning. Glad you're here. This is Thursday morning, and that must be Lane County Wellness Corner conversation that we have each week with practitioners, healthcare workers, wellness practitioners, doctors, nurses, and organizations in the local Lane County, Oregon area. Uh, it's a program where we give you those a direct line to those individuals that are making a change and assisting those that are in need of quality health care. Let me also just give you a quick intro to who we are. Lane County Wellness Consortium. Lane County Wellness Consortium has been formed exclusively to bring dedicated professionals from all fields of the wellness industry. In this 1 hour weekly show, there are several goals in mind. Introducing you to local practitioners and organizations to learn about their specialties and services, what types of clients that they work with and serve, and most importantly, how long it takes to get an appointment. This is a critical aspect of the consortium. The demand on services has never been so high. In many cases, a client can't get the help they need when they need it. Tune in and learn what you may not know about the wellness area in Lane County and get the latest updates on finding the right professional and organization to meet your needs. Okay. Well, let me introduce our guest today. This is real special for me because it's not an area of knowledge for me, so I'm learning about this guest and what his skill set is. Dr. Stuart Silberman is a licensed clinical psychologist in the state of Oregon. He specializes in stress management and interactive EEG neurofeedback for adults and adolescents in the Eugene, Springfield, and surrounding community. After experiencing a traumatic brain injury in a motor vehicle accident in 2007, Dr. Silberman discovered neurofeedback during his own recovery journey. The treatment played a pivotal role in restoring his cognitive function and reshaping his career path. Today, he integrates psychotherapy and neurofeedback to help individuals better understand themselves, regulate stress, and create meaningful, lasting changes to their lives. If you'd like more information, you can directly go to his website. Let me pull some of that information up right now. There it is. You can go directly to his website, www.drstuart, S-T-U-A-R-T, Silberman, SILBERMAND.com. And I'll leave that up for a second. Then I'll put also his email address and phone number up as well. So without further ado, let's bring Dr. Silberman in. Whoop, there, I had him. Hang on. I love technology. It's amazing. Good morning, sir. How are you?
Doing well. Good morning. Thank you for having me. I appreciate it.
Thank you for taking the time out of your busy schedule. Neurofeedback. My goodness. What is neurofeedback therapy? What is it? What does it do?
Neurofeedback is a drug-free, non-invasive technique to help the brain self-regulate. ultimately, what we're doing is working on the timing of the communication between the networks in the brain and making that communication more efficient and more effective. Um, Medications work chemically, the neurofeedback works electrically.
Mm-hmm.
Nothing goes into you, nothing hurts. I'm not shocking anybody. I'm only measuring the current electrical activity that one's brain is already producing and showing it back to the brain in real time. It's like the brain looking at itself in a mirror, seeing that it's not functioning as efficiently as it possibly can. And when it gets that information, it automatically changes its own function to improve.
Well, let me ask you just we mentioned medications. Does will this serve as a process for maybe not having to script medications? Or
Absolutely.
oh, okay.
This,
Well,
it,
that's a good thing, probably.
it is. This is something that oftentimes helps people wean off their medications and takes the place of the medication.
What what kind of conditions does this treat?
Any, primarily any mental health condition that anyone is coming in for, mood concerns, trauma, obsessions, sleep challenges, um, any type of panic or anxiety, a lot of physical symptoms as well, such as chronic pain.
Well, I've heard the word before, and I actually heard it many years ago, but it doesn't seem, or I don't hear a lot about its popularity. Is this something that's kind of off to the side, or is it becoming a, a mainstay service?
It is increasingly becoming more well known. It's
Hmm.
been around for many years. The challenges with it, though, currently are a lot of insurance companies don't typically like to cover it. And
Interesting.
so that is the underlying reason why. However, um, it is becoming more introduced into psychotherapy sessions and added in.
Hmm. Now, are you using this as a form of treatment on all of your patients, or just a segment of them? Do all your patients get the opportunity?
Every one of them uh, is doing neurofeedback. It is what I specialize in.
Yeah.
Um, and what I tend to find is as the brain begins to become more efficient at processing information, then I will go into psychotherapy. The person gets more out of the therapy session with a
Ah,
brain.
yeah, yeah, right. So, what inspired you to do neurofeedback therapy?
Well, that's a good question. And I had never heard of it. And when I went to grad school, it was not even mentioned.
Hmm.
Uh, but in 2007, I was involved in an auto accident, and I went many years trying to rehabilitate myself from a head injury that I received in that accident. And you know, I went 7 years looking for help, and not once was neurofeedback even mentioned. Um,
Now,
but
this accident happened what after you were already in practice, correct?
I was, well, I had completed everything for my doctoral degree, and I had finished my doctoral internship rotation. I was working in a correctional environment as a
Oh yeah.
psychologist candidate. And at the time, given the safety and security of that environment, uh, the head injury that I received, the executive function deficits I had challenges being safe and remembering a lot of the things I should have been able to recall.
Dr. Silberman provided these pictures, so they're a little graphic, uh, but this was an accident, and Denver, correct?
That
You
is
were, yeah.
correct.
And that the the truck is actually yours, correct? And the
Yes,
car was the car that rear-ended you.
that is correct. I was stopped in traffic about fourth or fifth in line, and you know, I was doing the right thing. I stopped at a red light, and the gal had fallen asleep and lifted up my truck and drove under me and then shoved me into the car in front of me and down the line. Um, and
Wow.
after that, I was out of work for a few months, and then uh, everything in my life changed functionally.
Yeah. Well, let me ask you, what is the one thing you wish more people knew about what comes from neurofeedback therapy? Is there, and then you can share with us a little bit about this picture.
The one thing that really comes with neurofeedback is self-regulation and an ability to put a lid on things when you need to. For example, if you have any type of emotional reactivity or rage, uh, road rage, for example,
Mm,
you can put a lid on it after neurofeedback. You don't have to go there automatically anymore. You can if you want, but you don't have to. This doesn't change one's personality. It only improves one's functioning. If you feel that you don't have anything that you want addressed, that your brain works perfectly, we can improve that and enhance it even better. The one real takeaway is that this looks kind of funny. It looks like it can't possibly do much of anything. You're coming to me and I'm saying I'm going to put wires on your head and solve your problems.
sure.
Uh, and you don't have to believe in it for it to work. And that's the one thing that really got me to do it is in my training, not once was it ever mentioned. And after that accident, I had hit rock bottom. I was like, fine, you say it'll help, hook me up. I don't care anymore.
How long did it take to for you to realize that you were actually going to get back in to the life that you originally had path with even more success than you could have ever imagined?
It took a little over a year.
Oh,
Uh, and
that's fairly quick, I think, isn't it?
it is.
Yeah.
I started noticing changes immediately within the first session. I had felt the most at peace that I had ever felt before. I was really shocked because here I am being extremely skeptical about this.
Mm-hmm. Mm-hmm.
And my life was in the toilet at the time, and you know, I had felt the most at peace, and I was okay with it. And I had hope that things were going to get better, of which I had never had any of that before.
Yeah. So, how did your own TBI shape the work you're doing today?
Well, today, given how powerful this method was for me, I now use this modality to help others in the same type of issues. I specialize in head injuries at this point, as well as chronic pain, um, sleep problems. And to me, I enjoyed what I was doing before, but this treatment modality has really shown to me to be the most powerful and effective treatment out of anything that I learned in grad school.
Oh, wow. Yeah. Well, then that says a lot because you were trained in school, and your residency training and all of those things are to lay down the foundation for your uh, psychotherapy path. And so that says a lot about neurofeedback in a lot of ways. So in cases like car accidents or chronic pain, how does retaining brain change recovery outcomes? How does that change that path? Or I'm not even sure how, really even how to ask the question. What's happening and why is it happening?
We are ultimately rerouting the timing of the communication from the networks in the brain. Right now, it's going from point A to point B, but that communication's bouncing off all these other areas, setting off those symptoms. My goal is to reroute that communication so it's more efficient, more effective. And given that the brain controls absolutely everything about you all day, all
Mm-hmm.
night,
Mm-hmm.
and it wants things as quickly and as efficient as possible. Once it learns a new, more efficient way, it's going to hold on to that and use it every day so it doesn't forget.
Is there, like you had mentioned earlier, that you actually noticed um, a change in that very first event or that very first um, application of neurofeedback. Can can you explain a little bit more about what that means? What was it that you felt, or what could you hang your hat on per se?
I felt the most calm and relaxed and at peace with my
Ah,
life and my situation in it than I had ever felt. It was a profound sense of, yeah, I've got all of these problems, but it's going to be okay.
yeah, your life was in chaos before
Yeah,
you did that, and now after just one application, it gave you the sense of relief or just the awareness that there could be that this could be successful. That's incredible.
it
After one,
is.
yeah,
And it was temporary. And
sure,
it lasted a few hours, and the calmness and the relaxation and hope lasted. uh, that piece lasted the rest of the day, and then it wore off. uh,
sure.
this is temporary, and the end goal is that when you stop, it is permanent. The sessions build upon each other, and consistency is important. There is just no set number of session where I can say, hey, you'll be good to go at number 29.
Right. It may take more, it may take less.
Right.
Yes. Yeah.
Every
Okay.
brain is different. This is an individualized process, not only to the brain that walks in the door, but further refined to target the top symptoms that one wants to go after.
Wow. That's incredible. Oh my goodness, that's incredible. So, um, it is can this be applied to other areas of wellness and mental health issues? The neurofeedback is a complement to physical therapy, chiropractors, physicians, or other wellness providers.
Absolutely. I oftentimes collaborate with a host of other providers, neurologists, massage therapists, PT. With a better functioning brain, I'm able to not only reduce the muscle tension, given the stress reduction piece, but I can also focus on learned movements and help the PT work more efficiently. Uh, and working with the neurology providers, I'm also able to work on headaches and migraines. A lot
Oh,
of
so the pain population. Oh my goodness. My next question. And this is I have a little bit of background um, in pain support. I worked for a laboratory, uh, neuro laboratory in back in 2012-13, and the opioid crisis that was still in its growth phase, at least here locally. Um, I I spent a lot of time in the pain clinics. Do I understand that maybe this could take the place of some of those pain pills that patients were? I mean, when you said that they're your physical therapists, chiropractors, those populations are seeing patients with pain.
Absolutely.
Oh my goodness!
I first started with neurofeedback working with the pain population.
Ah, wow,
And oftentimes we were able to reduce their medications, nerve issues, muscle issues. Eh, Even today, I had someone with neuropathy that I was working with, and historically, I worked with someone who, I wasn't even targeting the neuropathy specifically, but I took it away. And she had been living with this for 30 years, and it wasn't one of the main targets.
wow! That just fascinates me. It really does, because that just means that in my little brain, the thought of this very simple procedure, and I'm going to put this back up on the screen, this very simple procedure of sitting at a computer screen, listening to the audible, viewing what's on the screen, and that connection between the visual and the auditory, no pain whatsoever, uh, for whatever, half hour, 15 minutes. What's the time frame for? Is there an average time frame at each appointment, or
Each
they vary?
The feedback portion is about 30 minutes. I
Okay.
add 15 minutes for connecting you and cleaning you up afterward. What's going on in this picture is, as far as the client is aware, they're watching something and the screen is doing funny things. However, her brain is actually controlling the size of the screen, the clarity of the screen. In this one specifically, there's either a butterfly or a rocket ship going flying, and she's controlling the speed of that.
Interesting.
The volume that is going, that is also controlled by the brain. And when the brain is in the settings or in the range of settings that I want it to be in, it gets rewarded with the screen becoming big, clear, and the volume going up. When the opposite happens, the brain goes out of that range, it shrinks, fades out, and the volume goes down.
Mhm.
So there,
And so this is roughly 30 minutes of treatment, um, once a week, every day, every other day, once a month. What is the regiment for this service?
typically to start, it is twice a week. There is
Okay.
an exponential increase into it taking effect if another session is done before the last one wears off. And then,
Okay.
depending upon how happy the client is with the results of that, we can then begin to taper. Uh, but I typically would recommend twice weekly to get the
Yeah.
most efficacy out of the method.
Wow. I am. I got to say, I'm so excited. I've I've been waiting for this interview. It's just amazing to me, and now it's even got me to thinking about some of my chronic back pain and the potential relief. And not only that, but uh, maybe some other side effects. Um, I I had you send me some questions, and so this kind of leads us back into that. Just an alternative. It's not just associated with human health, But as we know, the brain is part of everything that we do. So, besides wellness providers, do you also work with corporations for neurofeedback to help business teams or work or companies?
I do. And
Oh,
what I
wow.
find is when you get the whole unit together, you get the whole team on the same page, everyone improves their functioning at the same time. And that executive function piece, the relaxation piece, you can get people working more cohesively and more efficiently. And you leave work in a much better place with higher productivity throughout the day.
So, wait a minute. Wait a minute. So, is this done in a group environment, or is each individual person have their own session, or are they in group, or are they in their typical work group? If three or four or five people.
I do have stations that are individual. I also have a room that has 3 stations in it.
Oh, be
And so I
doggone.
am able to run more than one session at a time. And so, depending upon the client's wishes, they can
Right.
either be on the individual stations or in the group room. I don't necessarily need to work with the entire team at once, but
Okay.
if the goals for the team are essentially rather all the same, the protocol that I use would be rather identical,
Right.
although
So
still individualized to the brain that walks in the door.
so there are some advantages to doing it together, and there are some need maybe to do them separately. But that's fascinating. I would never have given that thought. That's almost like what's the term uh, that companies you oh I'll come back to it. It'll come to me. Uh, maybe I need to come in and see you in my memory.
We
Yeah,
can make
well,
that happen.
yeah, that's I definitely have no. I'm in the half year turning 70, and I have noticed some neuro issues, forgetfulness. Not that that's unusual, but when it becomes problematic, maybe this is a solution.
Yeah.
So if you're in listening right now and you have a question for Dr. Silberman, please put it in the chat box. Let us know who you are, where you are, and we'd love to have you present a question to Dr. Silberman as well. I had noticed another question, which again, since we were just talking about business groups and uh, companies and individual like the sales shows that they put on. It looks like beyond that particular client, that athletes, dancing students, and other athletics benefit from neurofeedback to improve their performance and resilience. What is that all about?
We target similar the whole team or those who want to excel on their own and get a competitive edge. We do the peak performance training. For example, if you're part of a soccer team and you want to be the best one on that team, we can help. We can give you
Wow.
that competitive edge that others don't have. And if you want to have the whole team come in, we can do that also. It's all about getting that competitive edge. We work on not only reducing the stress and the anxiety that comes with performing, uh,
Yeah.
but in addition, the skilled muscle movements and learning the muscle movements that you need to learn in order to perform at the sport. And so altogether, peak performance is something that, if you want to be the best of the best, we can make that happen.
This is incredible, Dr. Silverman. I, like I had shared with you before we went live. I mean, I had been aware of them and I had seen some, data, but I really haven't had any experience with it. And I'm just astonished that this isn't more widely received, and for that matter, should be more widely received, especially because it's a passive influence. Is that safe to say that it's pretty passive
It's very passive, as
compared to other treatments?
the hardest effort the client needs is to come in. They sit here and they watch something with wires on their head and they get better. And so it's the most effort I need is to attend the session. And one of the things that I like the best about this method, especially with trauma patients, is I don't need to make you relive and retell the pinnacle of your trauma in order to help you.
Oh,
This works from the back end. You watch something that keeps your attention focused on the screen. That trauma processes behind the scenes.
so let me ask you another question. Has this changed the path of your psychotherapy practice? Because now, this I have a little bit of experience. My background was in psychology, and I did apply to counseling psych department here at University of Oregon. Um, I took a different turn right at the last minute, but what knowledge I do have is that the modalities that you use as a psychotherapist, if neurofeedback was not part of your practice, psychotherapy would be, depending on your mentors, depending on who you studied, depending on what path of training. Is there a difference between the psychotherapy that you learned and started practicing as a young man versus what you do today in psychotherapy?
Absolutely.
The
Uh,
modalities changed.
yes.
Can you elaborate a little bit?
The neurofeedback is the strongest tool in my tool bag to help people feel better. I believe talk therapy definitely has a place. The psychotherapy modalities does have a place. However, after you get the brain functioning more efficiently. At that
Wow.
point, the client walks away with a deeper understanding of what was discussed in the session and a greater ability to make changes in real life out of the appointment in daily functioning. And so,
In the now, you don't have to go back to yesterday. You don't have to live in the past. That's what I'm getting from. Is that kind of what you're saying?
correct,
You spend more time in the present moment.
exactly. And it
Oh,
brings you much more awareness to the here and now, life and your problems in it. And so now that you're aware of that, now now you take those issues to talk therapy and you figure out, okay, now that I know these are the issues that they exist, now what do I do with this information?
oh, that's huge. That's huge. It's interesting. It just popped in. Every once in a while you have an aha. I'm a uh, newly practicing Buddhist. I use it as a powerful tool in my own recovery, and uh, the the Buddhist thought is that we only have what we have in this moment. Yesterday's gone, tomorrow isn't here, and all you have is right now. And so this kind of reflects a little bit with me, and brings a little bit of gratitude. What What are the biggest wins that you've seen? Are there a couple patients, two or three, four patients that you've seen that just stand out besides yourself?
There are some where when they walk in the door, they are the grouchiest, most upset individual you've seen in a long time.
Hmm.
And you put on a couple of these placements, you start working with them, and because they feel better,
Hmm.
they're functioning better, their mood is improving, they become some of your most beloved clients. And you go from having someone that is a challenge that you really
Sure.
don't know what to do with, to someone that you have really, really helped make their life much better. Um, for example, a head injury patient in my career, he came in excessive chronic pain,
Hmm.
he could barely function, very similar symptoms that I had. So it was familiar. I knew exactly
Hmm.
what to do. He got his life back as well. He got his employment back. His pain was reduced. He got off a lot of his pain meds. Didn't get off all of them, but he was able to wean off the majority of them. Um, that was one. And then today, actually, I saw someone for the first time a couple of days ago, which was for sleep and
Oh,
fatigue
yeah.
issues, and a lot of physical jaw pain. Uh, Within the first session, I had dropped the pain level from an 8 down to a 4.
Wow.
And then she came in the next day saying, she had gotten the best sleep that she had had in many years. And it, the only thing that she did different was neurofeedback.
Yeah. So there are some big success stories. Oh, I was going to, the next is the pitch. If someone in the community is struggling with anxiety, sleep issues, chronic pain, trouble focusing, what would you want them to know about their capacity to heal?
That
It's
there
what
is,
we've been talking about the whole
yeah,
time. But
absolutely, there is hope. And usually I am someone's last resort, primarily because they don't know that neurofeedback exists.
yeah,
But there is hope, and this is hope with a very powerful treatment modality. About 80 to 90% of patients that come in get a positive benefit. And if you're looking at the efficacy of medications, you're expecting 33% as a
right,
good number.
right.
And so the majority of people that come in get benefits. It's with this modality, given that I don't need to make you hurt, either mentally or physically, to help you heal, it's hard to get new patients in because people like this. They stick around because it's effective. And so wait lists tend to back up because this is effective. People don't want to leave.
So your schedule's full is what you're saying. And back to my intro on one of the reasons why the Lane County Wellness Consortium was put in place was because of the resources, and they're very limiting, and a lot of people, and you just shared that it's tough to get an open slot. So does that mean you're getting a bigger office and more stations?
I could use some help.
Yeah.
The more stations I have, the more we can help. The more people that know about this, the more we can get society in a better place. And I did just move to a bigger office last week, And I now have room for more stations.
Oh, wonderful.
Yes,
Wonderful.
I'd like to do that.
Yeah. Well, it's been running on the ticker on the bottom. So get a hold of Dr. Silberman, definitely. So, um, another question, which is off from what we have been talking about, credentialing. What are the credentialing requirements uh, to at least observe or run one of these tests? Are there credentialing requirements for you to use this treatment?
There are the method I use is called the Othmer method, Othmer. It's the Othmer method of ILF neurofeedback or infra-low neurofeedback. And in order to obtain the credentialing, or in order to obtain the equipment, you are required to be trained by them through
Okay.
their
What's the algorithm again for that? OHT? Oh,
OTHMER.
OTHMER. Neurofeedback method. Here we go. Okay. I'll do a little bit more after. The credentialing require, oh, there they show it. Uh, so
Master's
do
level.
you have to have an MD behind your name in order to go sit for the credentialing? Or if you had somebody that had a background in emergency medical services and they went and got re-credentialed in this particular method, would they be of use to you?
They would. And anyone
Okay.
master's level or above in a related helping field um,
Right.
would be very helpful. And so, in order to get trained, there's a process. You do the sessions on yourself, they take you through the history, and they walk you through. And it was very eye opening for me when I did.
Yeah, it says at least 3 years of neurofeedback experience in a professional setting. So it looks like you probably be hiring somebody as a support tech or something. They wouldn't have be credentialed, but they'd have to work with you for three
Right,
years before they would even want to credential
right.
themselves.
And I can.
Right.
I would like to hire a QMHA or a QMHP and have them run the stations. Uh,
And now those are mental. That's a mental health acronym, correct?
Correct, qualified mental
Yeah.
health professional. Uh,
Yeah.
and so that they would, I create the protocols, they would run the stations,
Yeah.
and so that way I could get more people in.
Sure. And are you currently looking for one of those
It's
individuals?
a thought.
Okay. All right. Well, let's hope that you find who you're looking for. I have heard that acronym before, so I know that we have some here in Eugene area. But what a wonderful opportunity to grow your business as well. Um, we're getting close to the end here, but I want to ask a couple more questions. This is uh, we interviewed a gentleman last week, I think it was. They're slipping me. Anyway, on the veterans, he is a service provider for the veterans program out at the old county work camp. And anyway, Dan represents a group uh, of individuals that served in the military. That particular population definitely has a unique set uh, of issues that they deal with. One of them obviously is trauma. Uh, military trauma, common medical and mental health concerns. What do you have, or have you had current or past veterans, military personnel that you've worked with?
I have, and I am a community care provider through the VA Tri-West, and they will cover neurofeedback.
Yeah,
And I enjoy working with the veterans. They want the help, they get better from it, and they're motivated to do things differently. And oftentimes they are some of my best clients.
yeah. Well, yeah, I hate to say it, but it's the truth. We've done a disservice to our military personnel in a lot of ways, and uh, we find incarceration rates quite high with returning vets. We also see substance abuse disorder as a result of their self medicating, and it's just a real sad state that we see that this population that has served us, uh, war or no war, and they come away. A lot of them are homeless, and so this sounds to me like a perfect segue for them. Uh, in fact, I'm going to give a call out to Dan and see if he knows about you, and get a conversation going between the two of you.
Nice. Looking
Yeah,
forward to
yeah.
that.
Well, let me do this. Let me take a quick. Let's see, where are we with time? 15. Yeah, let me take a quick commercial break.
Lifestyles Renewed is a place where you can find a safe and welcoming place to begin to heal and create a life where suffering is not the regular path, but rather where you can learn to manage your life in a healthy way. Lifestyles Renewed will offer hope and help you regain control over your life. Please don't hesitate to call. Your first consultation is the most important meeting, and it is at no cost to you. Just call 541 954 1268. Again, 541 954 1268. Thank you, and we look forward to meeting you.
Okay, we're back with Dr. Silberman and the conversation about neurofeedback. My name is Jed Ray, and you're listening to LANE County Wellness Consortium's Wellness Corner on Thursdays. Every Thursday morning, we bring innovative conversations, and this one has been really special. And I am so glad, Dr. Silberman, that you took the time in your busy schedule to be here to talk with us about this. Um, One of the last questions is: do you have a statistical chart of looking at success versus failure and what that might look like? Um, a combination of obviously your psychotherapy background, but as well as a current status of neurofeedback.
I do. I do keep track of the targets that we're going for and the amount of reduction in severity of symptoms, not only per individual, but across the board as a whole. And so there are within and between statistics that I have, and typically 90% of everyone that comes in is responding in a positive direction.
So, are those subset also in terms of initial diagnosis? So, if it's say it's brain trauma versus addiction versus some other form of psychological condition, are those also separated as well and segmented into those categories?
I do have those separated out. For head injury, it really depends on the severity of
Okay.
what they're coming in for originally. If someone has a stroke, it's going to look different than if someone is in an auto accident. The symptoms, the severity range, it can be all over the place.
Mm-hmm.
Um, However, regarding all of them, the broad generalization is about 90%, even with the head injury. I have had some stroke patients of which
Oh,
they will get benefit. It just takes a long time, and you have to be real patient in
right.
order to see
For that
benefit.
population. Wow. Uh, those statistics stand way beyond most allopathic medical interventions. I mean, I spent 40 years in medicine. Most of mine was in emergency medicine and cardiology, but I don't think I've ever known any treatment to be in the 90 percentile. It's just, it doesn't, to my
Exactly.
knowledge. So that says a lot about what this neurofeedback really can do for yourself, for you as a clinician, and for those patients that come to see you. That's incredible.
Yeah, most people, especially with life-altering diagnoses, they think that's how they are for the rest of their life. They think they're stuck.
Right.
You're not stuck. The brain is plastic from cradle to grave.
Yeah.
If you have a brain, this will help. A living brain.
Yeah. If the gray matter's alive. Um, well, now that just brought up one question. Let me ask you, of those individuals that have degenerative gray matter, and we know that, I'll give you a great example, is excessive alcohol use. Excessive alcohol use, we've seen in scans, show that gray matter is non-reactive and non-active. Is neurofeedback a possibility of rerouting some of that pathway into matter that was maybe been inactive and dead for a year, 2 years, 3 years, 4 years?
Yes. And
Yeah.
it doesn't matter how long it's been inactive, we can rewire and reroute. The
Wow.
brain is plastic, and we can go around the damage. In regard to the dementias, Alzheimer's, uh, this isn't going to stop the progression
Correct.
of those, but it will slow it down and provide the person with a better quality of life for a longer period of time.
Wow. Dr. Silverman, I am so glad you connected. This is utterly amazing to me. Um, I got things turning here, and I've got all kinds of people I know that I'm referring to you. So this is going to be amazing. I can't wait. Um, Let me ask the last and probably most. I know we don't like to talk money, but and you did say that the insurance companies are a little hesitant. So, what does something like this cost? What are the costs for this treatment? And I granted you did say that there's no time frame. One person may need more, one person may need less. But what's a single treatment cost?
If paid individually, one session is 175,
Oh, goodness gracious.
or there's a package of 15 sessions for 2250.
That's just
And,
amazing.
and
That,
15 sessions is enough to see a significant measurable change. That's
yeah,
our decision point of whether we continue.
yeah. That, yeah, no, I won't. I won't get too political. I struggle with the insurance industry. That they I guess they pick and choose of what they want, what they don't want. And sometimes I kind of wonder whether, yeah, we won't go any further. Dr. Silberman, thank you so much. I really, really appreciate the time you've given. And if any of you out there listening, it's running on the bottom of the screen right now, reach out to Dr. Silberman. His email is right there and his phone number, 541-632-4655. And we are so blessed to have had you. Thank you so much for taking the time.
Thank you for having me. I appreciate it. It was nice to
Bet.
talk with you today.
Have a great day.
You too.
Okay, that was unbelievable. This is something that I think is a real critical piece to look at, and I think that if nothing else, just a conversation with Dr. Silberman would be the right path. Even if you have questions that you don't understand the process or you don't understand how it may help you, reach out and get a consultation. I'm sure that he'll sit down with you for a few minutes and have a conversation about whatever you're, dealing with in your life. Again, I just want to thank all of you for tuning in, and this has been a wonderful experience for me to learn about Dr. Silberman, local psychotherapist here in town, and his path to an amazing recovery. So we'll see you next week, 11:30 on Thursday. Next week we have oh, that's right, Alexandra Kollner. Alexandra Kollner. She is a hypnotherapist, and we will be chatting with her. She's local, been here for a long, long time, and her discussion should be exciting as well. So tune in next week, 11:30 on Thursday.